Today we are going to discuss about the topic is Helicobacter pylori. First we can see introduction. Helicobacter pylori is common. Many people have it. Helicobacter pylori is a type of bacteria that infects your stomach. It can also damage the first part of your small intestine. That means duodenal ulcer. This causes redness and soreness, inflammation. It mainly causes ulcers. Its characteristic, it's not capsulated, flagellated, non-sporing. Morphology, it's a gram-negative bacteria. It size 0.6 with to 2 to 5 micrometer in length. It is curved to spiral, gull-winged, U-shaped, circular-shaped. Some members are either a short or trapped rod shape, motile by means of flagella. Virulence factor. It responsible for colonization include urease, chemotaxis, adhesions. These are the virulence factor. CAG A and VACA are the most pathogenic oncoproteins involved in colonization, damage to gastric epithelium. During the addition of CAG A positive, that means addition means it may become positive. Next one is transmission. Helicobacter pylori is commonly transmitted from person to person by saliva. The bacteria can also spread by fecal contamination of food and water with poor hygiene. That means untreated water, crowded condition, dirty food, water, or anti-cells, mouth to mouth. That means kissing, contaminated pop or vomit. These are the transmitting agents of Helicobacter pylori. And next is pathogenesis. Survival under acidic stomach conditions. Next is movement toward epithelium cells through flagella mediated motility, attaching to host receptors by adhesions, causing tissue damage by toxin release. Symptoms. It is not clearly why many people don't have symptoms, but some people may be born with some resistance to harmful effects of its signs of symptoms include pylori infections are typically related to gastric or peptic ulcer may include, and the symptoms are an ache or burning pain in your stomach, that means abdomen pain, stomach pain that may hurts when the stomach is empty, nausea, loss of appetite, frequent burping, bloating, unitarian weight loss, bloody or black terry stools, bloody or black vomit or vomit that looks with like coffee grounds. Cases. Helicobacter pylori infection occurs when Helicobacter pylori bacteria infect your stomach. Bacteria are usually passed from person to person with a direct contact with the saliva, vomit or stool. Helicobacter pylori may also be spread through contaminated food or water. It may cause gastritis and peptic ulcer. Risk factors. The Helicobacter pylori often infecting in childhood. Risk factors of Helicobacter pylori infections such as living in crowded condition, living without a reliable supply of clean water, living in a developing country, living with someone who has an Helicobacter pylori infection. Complications. The complications are associated with Helicobacter pylori infection include ulcer. Helicobacter pylori can damage the protective lining of stomach and small intestine. This can allow stomach acid to create open sore ulcer. About 10% of people with Helicobacter pylori develop an ulcer. First, the starting stage is inflammation of stomach lining. Helicobacter pylori infection can affect the stomach, causing irritation and swelling. That means gastritis. Stomach cancer. Helicobacter pylori infection is a strong risk factor for certain types of stomach cancer. Ulcer. A peptic ulcer is a stomach is called as the gastric ulcer. A duodenal ulcer is a peptic ulcer that develops in the first part of small intestine, that means duodenum. An esophageal ulcer occurs in the lower part of our esophagus. What are the diagnoses of Helicobacter pylori? Testing is an important for detection of Helicobacter pylori. Test may be done using a stool sample through a breath test by an upper endoscopy exam. First one is stool test. Stool antigen test. This is the most common stool test to detect Helicobacter pylori. The test looks for protein antigen associated with Helicobacter pylori infection in the stool. Stool PCR test, a lab test called a stool polymerase chain reaction test can detect Helicobacter pylori infection in stool. However, this test is more expensive than a stool antigen test and may not be available in all medical centers. Next one is breath test. If you have Helicobacter pylori infection, carbon is released when the solution comes in contact with Helicobacter pylori in your stomach. These are the diagnoses of Helicobacter pylori. Next we can see biochemical test. Catalase is positive, uh, hydrogen sulfide is negative, gram staining negative, oxidase positive, urease positive. Next one is treatment. Helicobacter pylori infection are usually treated with at least two different antibiotics at once. Treatment may include medications to help your stomach heal, including proton pump inhibitors. The drugs stop acid from being produced in the stomach. Some examples of proton pump inhibitors are omeprazole, esomeprazole, isoniazid, and pantoprazole. Next one is bismuth subsalicylate, most commonly known by the brand name Pepto-Bismol. This drug works by coating the ulcer and protecting it from the stomach acid. Next is histamine H2 blockers. One example is cimetidine. Histamine blockers are only prescribed for Helicobacter pylori infection if PPIs cannot be used. Thank you.